found in the published research.
So this is an important milestone on the path, but we're now moving rapidly forwards to try to evaluate whether the vaccine actually protects the population by conducting large-scale trials. And we have 10,000 people already vaccinated around the world.
We still need to see how the vaccine performs in older people who are more at risk of severe disease than the people we vaccinated in this study. So that's the subject of future work, and there'll be more publications to come.
The Oxford vaccine is adapted from a common cold virus found in chimpanzees. Spike glycoprotein, a genetic material from the Covid-19 virus, was added. The hope is the human body will develop immunity to the spike protein, stopping the virus from entering cells and preventing infection. Tests indicate the vaccine produces two reactions by producing a defensive antibody response as well as T cells which attack the infected cells. T-cell response peaked just 14 days after vaccines were injected. Antibody response peaked at 28 days. And side effects were minor, mainly just tiredness and headaches, treated with paracetamol.
My fingers crossed, but to say that I'm 100% confident that we'll get a vaccine this year or indeed next year is, alas, just an exaggeration. We're not there yet.
This is a hugely encouraging result for the team here in Oxford, but provoking an immune reaction is just the first stage in vaccine development. Phase 3 trials already underway in the UK, South Africa and Brazil are looking at issues such as optimal dosage and exactly how much protection vaccinated people have when exposed to the actual coronavirus. Ellie Cannon was injected with the Oxford vaccine as part of the Phase 3 trials. She's a family doctor herself and has lost friends and patients to the virus.
Rather than sitting in front of the TV and screaming at the mortality rates every day or screaming at politicians or getting annoyed on social media, I really felt very strongly that I wanted to do something. I just wanted to be a part of the answer. I don't think there's going to be one answer to COVID. I think there's going to be a few different answers.
9 in 10 vaccine projects end in failure, and there is no guarantee that the early promise of the Oxford trials will lead to an effective COVID jab. But it is a very positive step. Paul Brennan, Al Jazeera, Oxford.